As health experts feared, patients being treated for COVID-19 in California's hospitals have soared in the weeks following an initial spike in transmission of the virus. The total rose to 3,683 in the most recent update from the California Department of Public Health, the state's most active hospitalizations since September 1. Similarly, the number of new cases also reached its highest point since August 17, an average of about 7,967 per day over the past week, after there were 6,595 reported around the state Sunday, according to data compiled by this news organization. In the past 2 weeks, the average number of cases reported each day has nearly doubled, a 91% increase from about 4,162 per day at the start of November, while the number of patients hospitalized has increased by nearly 50%. In Los Angeles County, which is already under the most restrictive reopening guidelines from the state, is now reported to be considering additional action after a surge of new cases over the weekend prompted more concern. There were nearly 7,000 new cases of COVID-19 reported in LA County on Saturday and Sunday alone, about 47% of the entire statewide total for the weekend, despite LA's approximate 25% share of the population. Cases in the nation's most populous county have risen by 84% in the past 2 weeks and on Sunday reached their highest point since the first week of August, at about 2,479 per day over the past week. In the Bay Area, there were about 85% more cases reported each day, on average, in the past week than there were 2 weeks ago. Last week, the daily average broached 1,000 cases per day for the first time since the third week of August. The pace of new cases is accelerating, but transmission has been slowly rising in most parts of California for close to a month. The rise in hospitalizations began about 2 weeks ago, around the start of November. In that time, few locales have been spared the increased strain on their medical systems. In the Bay Area, the number of patients being treated for COVID-19 is 33% higher than 2 weeks ago. In Santa Clara County, the region's most populous, hospitalizations have increased at nearly double that rate, up 63% in the past 2 weeks, while others have seen more modest increases, about 28% in Contra Costa County, about 11% each in Alameda County and San Francisco. The 8 counties that make up the San Joaquin Valley had about the same number of patients as the Bay Area region when November began. But that region has seen an even more dramatic increase, up 61% in the past 2 weeks to 486, as of Saturday, compared to 403 active hospitalizations in the Bay Area. In every county in Southern California, there are at least 30% more patients hospitalized than there were 2 weeks ago. In Los Angeles, the total is over 1,000 for the first time since September 1, a 35% increase in the past 2 weeks, and in Riverside County, hospitalizations have doubled in that time to 310, as of Saturday.